Welcome to Medical Ocean. Today our topic is critical care nursing CCN MCQs. Most important MCQs for BSc in 7th semester. It will help in your midterms and final term exam. First of all, we will discuss MCQs. Number 1. There can be variation in the minute ventilations in one of the following mode of ventilation. Is the respiratory rate and tidal volume is determined by patients. Controlled mandatory ventilations, synchronized intermediate mandatory ventilations, pressure support ventilations, and pressure controlled ventilations. Which one of the following is the correct? Minute ventilations in one of the following mode किस में होता है minute ventilations? जी कौन बताएगा? Option A, B, C, D. Which one of the following is correct? Option D is the correct option. Second पे हम आते हैं. One of the following mode of ventilation reduce the work of breathings by overcoming the resistance created by ventilators tubings. Controlled mandatory ventilation, synchronized intermediate mandatory ventilations, assist control mode, and pressure support mode. Now question number 2. Which one of the following is the correct? G. Option D is correct. Pressure support ventilations. Question number 3. Which are the ventilator parameters adjust to maintain the optimal minute ventilations? Optimal minute ventilations में हमारे पास कौन सा होगा? Option A FiO2, Option B PEEPs, Option C tidal volumes and respiratory rate, Option D both A and B. The correct option is parameter adjust maintain optimal minute ventilation is tidal volume and respiratory rate. So option C is the correct options. 4. Minute ventilation is equal to minute ventilation आपके पास equal है FiO2 multiplied by PEEPs, FiO2 PEEPs tidal volumes divided by respiratory rate, tidal volume divided by respiratory rate. Which one of the following is correct? G. Minute ventilation is equal to tidal volume and respiratory rate. Option C is the correct option. Question number 5. The mode of ventilations which allow the patients to breathe spontaneously at his her own respiratory rate and depth between the ventilator's breath is controlled mandatory ventilation, synchronized intermittent synchronized mandatory ventilations, assist control mode, and pressure support mode. Which one of the following is the correct option in MCQs number 5 is option synchronized intermediate mandatory ventilations. Option B is the correct option. Let's move to question number 6. One of the following mode of ventilation has the risk of patients getting respiratory alkalosis due to hyperventilations: controlled mandatory ventilation, synchronized intermediate mandatory ventilations, assist control mode, and pressure control mode. Question number 6. Which one of the following is correct? Assist control mode is the correct options. Which assist control modes? 7. One of the following mode of ventilations lock out the patient's efforts to breathe: controlled mandatory ventilation, synchronized intermediate mandatory ventilations, assist control mode, and pressure control mode. G. Which one of the following is correct? Option A is correct. Controlled mandatory ventilations. 8. An artificial airway like an endotracheal tube is used in the following types of ventilation: positive pressure, negative pressure. Both A and B are the correct, none of the above. Which one of the following is correct? Option A is the correct, positive pressure. MCQs number 9. Which one of the following is an indication for mechanical ventilations? A post-operative patient with mild hypoxemia, a post-operative patient with head and neck surgery, a stroke patient with left hemiparesia and good consciousness, a pneumonia patient with dyspnea and hypoxemia despite oxygen therapy. जी इसमें कौन सा पेशेंट जो है उसको हम वेंट पे डालेंगे? जी कौन सा पेशेंट जो है हम उसको वेंट पे डालेंगे? बोलो। ऑप्शन डी, नमूने पेशेंट्स है, उसको डिस्निया है एंड हाइपोक्सीमिया है, ऑक्सीजन की नीड है इसलिए उसको हम वेंट की ज़रूरत है उसको। क्वेश्चन नंबर 10, विच वन ऑफ द फॉलोइंग इज़ अ कॉम्प्लिकेशन रिलेटेड टू मैकेनिकल वेंटिलेशन? डिस्यूरिया, हाइपरटेंशन, नीमोथोरिक्स एंड डिक्रीज इंट्राक्रेनियल प्रेशर। जी क्वेश्चन नंबर 10 में विच वन ऑफ द फॉलोइंग इज करेक्ट? Dysuria, hypertension, decrease intracranial pressure and pneumothorax. Option C is the correct options. For pneumothorax is a complication of ventilators. Okay. Question number 11. In respiratory pneumonia patients receive mechanical ventilations for 2 days. He is now on SIMV mode, synchronized intermittent ventilation modes, and tidal volume is 500 mL, rate is 2 per minute, PEEP is 5 cmH2O, no pressure supports, FiO2 is 0.4, high saturation is 99%. Which one of the following criteria is used for extubations? High fever, adequate cough, respiratory acidosis with PaCO2 is 255 mg, stable hemodynamic. जी option D is the correct, stable hemodynamic. After extubation, what should be given to all the patients? Oxygen, analgesic, sedative and breathing exercise. जी ऑक्सीजन भी इम्पोर्टेंट है लेकिन ब्रीथिंग एक्सरसाइज आपके पास मोस्ट इम्पॉर्टेंट, तो ऑप्शन डी इज़ द करेक्ट ऑप्शंस. 13. Which are the characteristics of stable angina? Chest pain that occurs with exertion and or emotional stress, severe and crushing chest pains, chest pain that occurs at rest, bradycardia. A is the correct option, chest pain that occurs with exertions or emotional stress. 14. What is the pathogenesis of unstable angina? Coronary artery vasospasm, rupture of an arteriosclerotic plex with thrombosis and incomplete occlusion of a coronary artery, arteriosclerosis of coronary artery with 70% of stenosis, rupture of an arteriosclerotic plex with thrombosis and complete occlusion of coronary artery. जी unstable angina is option B is the correct option. 15. What is the key complication in the first 24 hours of MI? Fibrosis, pericarditis, coronary artery aneurysm, arrhythmias, mitral insufficiency. Option C is the correct, arrhythmia. Therefore, we do not allow the patient to move from the bed for first 24 hours after SK. 16. A client with chronic pain report to you the charge nurse that the nurse have not been response to request for pain medication. What is your initial actions? Check the MAR, medication administration sheet, सही MAR sheet, and nursing notes for the past several days. Ask the nurse educators to give an in-service about pain management. Perform a complete pain assessment and history on the clients. Have a conference with the nurse responsible for the care of this client. Option D is the correct option. Question number 17. As the chart nurse, you are receiving the charts of the clients who are assigned to a newly graduate RNs. The RN has correctly charted dose and time of medications, but there is no documents regarding non-pharmacological measurement. What action should you take first? Make a note in the nurse file and continue to observe clinical performance. Refer the new nurse to the in-service education department. Quiz the nurse about knowledge of pain management. Give price for the correct dose and times and discuss the defect in chartings. Which one of the following is correct? Option D is the correct. Give praise of the correct dose and timings. Discuss the benefits in chartings. Question number 18. In caring for a young child with pains, which assignment tool is most useful? Simple descriptions, pain intensity scales, zero to 10 numerical pain scales, face pain rating scales, MC scales, Malzik pain questions. Question number 18. Face pain rating scale. Option C is the correct options because it's child. 19. Which routine of administration is preferred if immediately analgesia and rapid titrations are necessary? Intraspinals, patient control analgesia, intravenous and sublinguals. G. IV. Which one of the following is correct? Intravenous is the correct. 20. In educational clients about non-pharmacological alterations, which topic could you delegate to an experienced LVNs who will full function under your continuous support and supervision? Therapeutic touch, use of heat and cold applications, medications, transcutaneous electric nerve stimulations. G. Which one of the following is correct? Used heat and cold sponging. Option B is correct because they are LPN, they are helping the nursing assistants. Okay, thank you so much for watching this video. Next MCQs will upload soon. It's first 20 MCQs. May it will help you in your exam KMU.